All right, here we go. Hello, everyone, and thank you for watching this webinar on direct primary care. There's no audio taping or videotaping allowed, and any unauthorized reproduction, dispensing, forwarding, or copying of this target coding presentation is illegal. Just tell you a little bit about myself before we get started. My name is Dr. Marty Kotler. I am a chiropractor. I'm also a certified professional compliance officer. I'm a certified billing and coding specialist. I practiced for many years. And, I consider myself a little bit unconventional because, if you think about it, most chiropractors are not certified coders. Most compliance officers are not chiropractors. So I take this unique approach towards compliant billing and coding and documentation. For example, I could have a client send me notes and I can challenge the doctor and say, hey, you diagnosed myelopathy. Do you know what that is? You diagnosed the patient with cervical radiculopathy. I don't see that you did the proper orthopedic neurological test to substantiate it. So I could take this kind of unique approach. My areas of expertise include CPT coding, ICD-10 coding, HCPCS coding, Medicare and HIPAA compliance. I've written many training manuals on billing, coding, and documentation, not only for chiropractors, but for acupuncturists, physical therapists, and massage therapists. I write articles to many publications throughout the country, like the American Chiropractor, Dynamic Chiropractic, Chiropractic Economics, many newspapers and journals, and I'm a guest speaker at many state association conventions throughout the country. So there's a little bit about myself. Now let's get right into direct primary care. For those of you that are not familiar with it, let me just give you some of the basics here, the key points. So DPC, direct primary care, this is a private contract or agreement that a healthcare provider makes with a patient or an employer. Now, this type of care is allowed in 25 states at the present time. You should see them on your screen. So if your state is not listed, then this doesn't apply to you. So many states now allow direct primary care. And for some of you, even if you're in one of the states listed, you might not want to do it. I look at direct primary care as just another option, like cash, credit card, check, DPC, discount medical plan organization, insurance, PI. I just look at it as another option. So with this option, it allows you to have a lot of flexibility. You can go up to patient A. Okay, patient A, we offer direct primary care here in this office, and we're going to provide you unlimited care at a fixed fee. So for X number of dollars, I don't know, for $500, you can come in every month. It's a monthly fee, if not $500, and you can come in as much as you want. Patient B, you can come in for $400. You could come in 8 times a month. Patient C, for $900, you could bring in your entire family and come in as much as you want. Patient D, you get my point. You could create these unlimited care services at a fixed fee. It could be different for each patient. And this eliminates insurance. There are instances where patients will come in with insurance with huge deductibles or very high copays. They may want to opt out of that and have them join your direct primary care services. So we're going to get a little deeper into direct primary care in a few minutes, but let me talk a little bit about fees. Okay, let's talk a little bit more about fees before we dive back into direct primary care. So here's a question. I get these all the time. Dr. Kotler, I've been in practice for a while. I just want to, I don't want to deal with insurance. I just want to have one fee. I just want to charge, I don't know, $50. for every man, woman, and child that comes into my office. That's what I want to do. Is that possible? Well, probably not nowadays. I'll share with you in a couple of minutes what I mean. But the main thing is you need to be profitable, right? You need to be profitable. I know some staff members listening to this right now chuckling because the doctor is constantly giving away free services. The doctor just undercharges. The doctor doesn't value, right? So I know some staff members chuckle when I talk about this, but you need to be profitable. If you're not profitable, how are you going to be able to treat patients? So I know some classmates of mine that terrific chiropractors, excellent students, top of the class, great adjusters, not in practice anymore, teachers, or nothing negative about it, but they couldn't make it in practice. Not that they didn't want to practice, they wanted to practice, they couldn't make it because they didn't know how to run a business. So here's a little exercise all of you should do. How much does it cost you to provide a chiropractic adjustment? How much does it cost you to provide a patient a treatment? I'll show you how to figure it out. What's your overhead? Let's say it's $10,000. That's your rent, all your overhead expenses, your malpractice cost, salaries. Let's say it's $10,000. And let's say you see about 100 visits a week. I think that's the national average. I think that's what Chiropractic Economics put out in their last survey. I think it's about 100, a little over, maybe 110, 120, something like that visits a week. So let's say it's 100 a week. So 10,000 divided by 400 comes out to $25 a visit. That's what it costs you. So I've done this exercise with some of my clients, and their numbers, some of them are coming out pretty high, like $40. I said, Doc, wow, $40, that's what it costs you. I said, what do you charge your cash patients? He said, oh, I charge $35. I said, you see how that's a problem? You're losing $5. Well, and then I get a little pushback. Well, some of my patients I charge more, some of my, are free, Well, you gave me the numbers, right? So if it comes out to $35 and you're charging patients $30, right? You're losing money. So do the exercise. Now, one fee. I want to charge $50 across the board for every man, woman, and child that comes into my office. Okay, well, okay, so let's say $50. That's your regular fee. Now, if you're in network with, let's say, Blue Cross Blue Shield, Aetna, Cigna, United Healthcare, right, a managed care, you can't get 50. They might say, oh, we'll give you 40. Okay. And then you could say, well, my normal fee is 50, but I'll take care of Medicare patients. Well, Medicare pays 35, so you have to write off 15. Oh, you're going to see PI and work comp patients? Well, the fees could be more or less than your regular fees. So nowadays, typical chiropractic practice, it's hard to have one fee across the board. Now, I'd say about 20% of the doctors that I work with are all cash. They are out of network on all plans, and they are trying to do this one fee across the board, but it's not that easy. It's possible to have multiple fees, like your normal fee is 50, Blue Cross Blue Shield only pays you 40, and Medicare pays you 35. That does not mean you have a dual fee schedule. So I break down every single man, woman, and child that walks into your office is going to fall into one of these 8 categories. If I missed a category or two, let me know. Put it in the chat box or email it to me. But I could pretty much, categorize every man, woman, and child that goes into every chiropractic practice across the country into one of these 8 categories. So let's start with direct primary care. Here we go. So it's a contract between the provider and the patient. This is not insurance. Direct primary care is not insurance. That's the question I'm getting all the time. Dr. Kotler, I didn't think this was legal to have this special arrangement. Well, if you're going to ask me a legal question, ask an attorney, ask your state association. Every good quality state association has an attorney, a general counsel. So talk to the attorney to get that question answered, but it's not insurance, and it does not apply to federally funded patients like Medicare. So chiropractors can enter into direct primary care agreements, assuming your state allows it, and chiropractors are included. That's another thing. I put up those 25 states. That doesn't mean every state allows chiropractors to do it. What do I mean? There are some states that allow direct primary care, but chiropractors are not part of the bill, the law in that state. So again, check with it. Check with your state association. So chiropractors can enter into DPC agreements with individuals, families, and employers for an agreed upon monthly fee. So what does this do? By having this private agreement, again, for some of you, this is very appealing. For some of you, this is not going to work out. For some of you that you find this very appealing, there are some negatives to this. So we'll get to those in a minute. So direct primary care agreements, the contractor agreement, eliminates billing insurance. That's it. There's no insurance billing. So you might say, wait a second, Dr. Kotler, what do you mean no insurance billing? That's the purpose of this agreement, is to eliminate filing claims, to eliminate appealing claims, to eliminate having to hire staff to submit claims and post payments and all of that stuff. Now, you as the provider, you choose what services are going to be offered. Again, that is up to you. Again, make sure the agreement that you put together is legal. You must get an attorney to create this legal contract between you and the patient or the employer, right? So you could apply this to patients. What some of my clients are doing is they're taking it to the next step. They're going to employers. I have one client, he's going to AT&T. He has an office building right near his office, AT&T. 300 people work in this building. He is going to he's going to try to have these employers all come to him, all these employees of this company, come to him under a DPC, one DPC for the entire employer. So it's very appealing for some. For some, it's just not right for your practice. That's why I say just make it one of your 8 choices. So you choose. The written agreement must allow either party to terminate the agreement within 30 days. Allow immediate termination if there's violation of the agreement. Describe the scope of services that are covered by the monthly fee. You need to specify exactly how much the fee is going to be. The duration of the agreement. Again, the patient's not happy, give him a refund. The agreement must state this is not health insurance. It just eliminates having to deal with insurance. It's not health insurance. It's another option. And the patient must understand that there is no submitting of insurance. It's in the agreement. If the patient after a month says, hey, I paid you $300 a month for that DPC agreement, now can you submit the claims to my insurance to eat up the deductible? No, that's not part of the agreement. And your agreement should state if the patient is adamant about billing insurance, then that's violation of the agreement. It terminates, and then you should be able to bill your normal fees to the insurance. Patients need to understand that. This is not Medicare allowed. This is not workers' comp. Can't do this for work comp. You could offer agreements to individuals or families lacking health insurance, or again, with high deductibles. So make sure to contact an attorney and your state association prior to implementing a direct primary care service agreement into your practice. So that's number 1. Number 2, there's 4 subcategories with number 2, cash, just cash. No discounts here. I have a sample cash plan, 75, 125. This is a 30-visit cash plan. Patient pays as they go. Yeah, just pay as you go. That's a lot of doctors do pay as you go. Now, while some offices may find it easier to simply mail a statement, don't mail statements. If a patient is coming in, they're paying as they go. They're supposed to pay $40 a visit, and then they forget. They go, send me a bill. It costs $5 to $10 per patient to send out a statement. I read an article about that, and studies show that the chance of collecting from the patient after they don't pay, it drops almost 20% as soon as they leave the office. Collect the fees that you owe. You shouldn't be embarrassed or ashamed to collect your fees. You're providing a valuable service. Next, prompt pay. So that's the question. I get, Dr. Kotler, my normal fee is $100 a visit. Now I want the patient doesn't have insurance or they have a high deductible. I want to give them a discount. Okay. It used to be called time of service discount. That's really an outdated term. The term you should be using is prompt pay. So that's the question we get here at Target Coding all the time, and our consultants are always dealing with doctors all over the country asking this question. How much could I discount? My normal fee is $100. Could I knock off 20%, 50%, 80%? What percentage? So what we like to do here at Target Coding is provide good quality information to our clients. We've been doing it for over 10 years. Good quality information means providing doctors with black and white reference data from reliable sources, local, state, and federal reliable sources. So when I get this question, Dr. Kotler, how much could I discount a patient off of our normal fee? I tell them about 15, 20%. Where did you get that, Dr. Kotler? We never heard that. We do 70%. Well, where did you hear that? Give it to me in writing. So I have something in writing. Here it is. This is right from the OIG. Pretty reliable source, I would say. You might not like the source, but it's a reliable source that people depend on. So they have an opinion. It's about 15%. Next, Dr. Kotler, I want to have patients prepay. Am I allowed to do that? Prepay, that's different. There's prompt pay and there's prepay. Prepay plans are terrific. Patient pays for multiple visits in advance. There's less congestion at the front desk, less admin work. Patients rarely miss appointments that are prepaid, right? And to me, the patients that prepaid in my practice, they were the biggest cheerleaders. They understood chiropractic better than anyone, the ones that would prepay, especially for wellness maintenance care. The negatives are offering prepay plans to insured patients could violate your in-network agreement. You're not allowed to do that. Well, I shouldn't say that. I don't speak for the plans. I'm not telling you to join plans, drop out of plans. That's up to you. But if you are doing prepays for covered services, check with the plan if you're in network. Definitely don't do that with Medicare patients. And you may have to put the money in an escrow account. Next situation is hardship. Some patients just can't afford to come in. And there are certain situations that allow healthcare providers to waive partially or in full the collection of these amounts. I would take this on a case-by-case basis. I was just dealing with a doctor the other day, client of ours through our Gold member program. So he calls me up and says, hey, I am providing all the teachers in my area. I don't collect the copay. I just waive it. It's a $20 copay, and all the teachers and the firemen have the same plan. He waives the copay on all of them. Is that okay? Right? These are the questions I get all the time. So you should do this on a case-by-case basis. You're not supposed to waive copays. You're not supposed to waive deductibles. Do not waive copays, coinsurance, deductibles. Now, how much of a hardship does the patient has to have? That's another question. Patient says they can't afford it. Okay, so there's stuff right from the federal government. Anybody wants this sliding scale? This is right from the federal government on how to provide a discounted hardship fee schedule. Next, right? Number 3, we're up to in-network. You're in-network, bill your normal fees. You're required to bill for all the covered services. You have to collect the co-pays and co-insurance, bill your normal fees. When you're in-network, you have to accept the contracted fee. Out of network, I'm just going through these pretty quickly. This webinar was mostly to discuss and help you understand direct primary care. But I thought, while I have you here, let me just go through these. Out of network, terrific. Also, you must collect co-pays and co-insurance, bill your normal fees, balance bill the patient the difference. Now, with out of network, you could accept assignment or not accept assignment. If you're out of network, sometimes the checks go to the patient. At maximum therapeutic benefit, transition the payments to the patients to wellness or discharge them, right? So just going through these pretty quickly. Now, Medicare. So let's talk about Medicare. There's par, there's non-par. Oh, I have a little Q&A for you. You ready? Can you treat Medicare patients without being enrolled in the Medicare program and billing Medicare? The answer is no. Please don't be in the middle. Don't be one of these doctors that say, well, we see Medicare patients, but we don't bill Medicare. I don't even know if I have a Medicare number. I don't know. We haven't billed Medicare in a while. But when a Medicare patient comes in, we just have them sign the ABN form and we collect cash and we don't bill Medicare. If you're doing that, stop. What did I say? Stop. That's illegal. It's high risk. There's low risk things, moderate risk, high risk. If you want to see Medicare patients, you must be formally enrolled and you must bill Medicare. If you're not doing that, you have a choice. Get enrolled and bill Medicare or stop seeing Medicare patients. If you're not billing Medicare and you don't want to bill Medicare, stop seeing Medicare patients. Can you opt out? No. Can you collect cash from Medicare patients without billing Medicare? Yes, but the patient has to get to wellness maintenance, sign the ABN, and check option 2. Here's a little information. Yeah, sometimes when I bring this up, doctors get frazzled. Staff goes, what? We see Medicare patients. They just pay us cash. We don't bill. I thought we could opt out. We're non-par. Yeah, I know. I hear all of those things. If you're not billing Medicare for spinal manipulation, you're performing insurance fraud. It's illegal. Don't believe me. Go to this website here. The other thing here, I like to give the black and white reference data. Now, some chiropractors say, yeah, I just have the Medicare patients sign the ABN form. I'm not in Medicare. They just sign the ABN form and they pay me cash. Well, just a little heads up. If you're not formally enrolled in the Medicare program, you're not allowed to use the Medicare ABN form. Medicare says that's our form. You want to use the Medicare ABN form? You have to be enrolled. Don't believe me? Go to the link at the bottom of the page. It's all there. You should have it and put it in your compliance manual. Here, there's another thing. Doctors may not opt out of Medicare, noting that opting out and being non-par are the same things. So back to Medicare. Cash? Yeah, cash. Exam? Cash. X-rays? Cash. Therapies? Cash. Your par? You submit the claims, you get 80% allowed, and the checks will come to you. Collect the 20% from the patient unless they have like AARP or something like that and you want to accept assignment. But you don't even have to accept assignment, even if you're par on the secondary or supplemental plans. Now, if you're non-par, you have a choice to be accepting assignment or not accepting assignment. If you're non-par, my recommendation is don't accept assignment, but you can't collect your normal fee. You're limited to the limiting charge. Now, the amount that you charge as far as the limiting charge, if you're non-par, not accepting assignment, depends upon if you're still involved with the meaningful use 2% reduction and the PQRS reduction. Now, that changed in 2017, January 1st, when we went from the PQRS and the meaningful use penalties over to the MIPS program. So, depending upon if you're par, non-par, will change the amount you can collect from the patient. But for all the non-spinal manipulation services, you should be collecting your full normal fee. I know that was a lot, and sometimes I speak pretty quickly, so hope you all got that. If you didn't, just send in your questions. Now, I kind of grouped PI and work comp into the same category. So work comp rules in most states, you can't collect any money from the patient. With PI, you're probably going to accept assignment. And if you don't, the attorney probably won't refer patients to you. So just be careful. Avoid the dual fee schedules here. Like you can't charge $250 to PI and then do the same exact services for $30 on a cash patient unless you put them in a discount medical plan organization like Chiro Health USA or direct primary care. So that was a good segue into DMPOs, discount medical plan organizations. This is one of the best ways to get around the dual fee schedule. You want to charge $500 a visit to insurance, and you want to charge $20 for the same services, you have to join a company like Chiro Health USA. There's a few others out there, but the only one that I recommend is Chiro Health USA for a couple of reasons. One, they've done their homework. Number two, they give back to the profession more than any other DMPO that I've seen in the industry. So here's a little information. Chiro Health USA could help you with a lot of things. So you join their network, the patient pays the fee, it's free to the provider. You could substantially discount your fees, it prevents dual fee schedules. After the Chiro Health USA, then set the patient up on an auto debit. And then the last category is patients are coming in with these health savings accounts, flexible spending accounts. Here's a sample walkout statement you can give to the patient. Very simple. Most of the doctors I work with are not participating with any HSA. I know of a couple, but it's rare. So just want to end with my 9-step action plan. Step 1, you have to get proactive. Step 2, all new patient forms need to be signed by the patient and completely filled out. Staff members, do not let the patient pass the front desk to see the doctor unless all the forms are completely signed and completed. Doctors, before you go into the room to see the patient, review all the new patient paperwork. Some offices have a lot of paperwork. Some offices don't have enough. Some offices are using forms that are outdated and old and don't even make sense. That's part of what we do here at Target Coding. I guess actually for the 9-step action plan, step 10 would be to contact Target Coding for help. I should put that in, I guess, because many doctors that we work with that show us their forms, they're old, they're outdated, they don't make sense. They're actually making things worse. So get a forms evaluation. It's a lot of forms. There's HIPAA forms. Make sure you're using the right HIPAA form. I was working with a doctor recently. I was reading his HIPAA form. I saw all this dental information in it. I guess he didn't read it. I guess his staff never read it. I guess his patients aren't reading it. I was the first one, I guess, to read his HIPAA form. It had all this dental information in it. I said, Doc, where did you get your HIPAA form? He said, oh, my brother-in-law is a dentist. I just took his. Yeah, so get good quality forms. Step 4, review the policies from the insurance companies you bill the most. Yeah, that's a good idea. Next, understand the what and the why. The what is your CPT codes. The why are your ICD-10 codes. They need to pair. Like wine and food, they should pair. So, oh, yeah. This is a page out of a book that shows you how to pair your CPT codes. You see the CPT code is at the top, 97110, and then the diagnosis codes are listed underneath it. So this is how you pair your procedure codes to your diagnosis codes. Oh, this is another page out of the book where if you're going to use a diagnosis, let's say like cervical radiculopathy, what do you need to have to justify it? It gives you little helpful hints. Oh, yeah, the patient had pain from the neck and it was radiating into the arm. We did Jackson compression. We did shoulder abduction. We checked reflexes. We checked for myotomal weakness. There was limited motion, subluxations, palpatory tenderness, segmental dysfunction. You see how nice? This tells you how to justify the most common diagnosis codes used in chiropractic. Yeah, this is the book that those pages come from. Step 6, do a self-test on your soap notes. Make sure you know what a medically necessary soap note looks like per insurance company. The requirements are different per insurance company. Step 7, attend seminars, webinars on a regular basis. Always keep learning how to improve your patient care and your business. Step 8, put together a simple policy manual. If you don't know how to do it, let us know. We could assist you. It's not a big deal to put together a simple policy manual. This is what some doctors do. I did it. If a patient said, "Doc, my neck hurts," I checked the thoracic. I checked the lumbars. I did activator on some patients. Their problem was neck. I'm checking their ankles. I have clients where they are upper cervical doctors. Patients are coming in with low back pain. How do you explain that? If you don't explain it, it could look weird. You're adjusting the cervical, thoracic, lumbar, sacrum, pelvis, the knee, and the hip, but you're only billing 98940. That looks weird, right, to some reviewers. How do you explain that? Step 9, conduct regular meetings, specifically with staff members that do your billing, especially to the insurance companies that pay you the most. I call it the 35% rule. If 35% of your income is coming from one health insurance company, do a deep dive into what their policies are, what they pay for, what they don't pay for, just in case they come knocking on your door. You want to be able to SWAN. That's my favorite acronym. You see it on the slide, SWAN. That means sleep well at night. I have a doctor right now. He has an insurance, he has a bunch of employees coming in from this one particular insurance company, and he has a billing company. And the billing company was adding modifiers, changing codes, and now he's being audited, and there's a claim block. Just because of this one claim block, I'd say he's lost about 60% of his income pretty quickly. So do a spot check on your billing company if you use one so you could SWAN. So just a few closing comments. Please check with all the carriers you bill prior to submitting claims. Make sure it's compliant. Thank you for attending. Here's my contact information, Dr. Kotler at targetcoding.com. Now, besides these webinars, we do seminars. We have on-site consulting. We offer membership programs, compliance programs, videos, forms. This is our Smart Choice program. This is just a quick sweep. This is like a scrubbing of your claims, your EOBs, your forms. It's a one-time fee. We're in and out. We tell you what's good. We tell you what's not good, and we're out quickly. This is not a long-term agreement. This is not a long-term contract. We have forms. Even if you have the best software out there, you think your chiropractic software is amazing and you love it, you still need forms. So this forms package, we break it down: new patient forms, financial admin forms, exams and treatment forms. So like I said, you could have the best software in the world, and now the insurance company says, we're denying your care due to lack of medical necessity. You ain't got that in your system now. You need letters of medical necessity to help fight appeals. We give you a whole bunch for those. We give you about 10 sample soap notes, physical therapy forms, acupuncture forms, Medicare forms, and 23 HIPAA forms. So let's go take a look and see what questions have come in. Oh, we also offer billing and coding compliance manuals. We customize these for your practice. You get employee training logs, forms, templates. You see, every year you have to do things. You should have an annual checklist. Like every year, you have to do a review of your notes. Every year, you need to do a system check on your software. Every year, you need to go in and enter all employees that are involved with Medicare billing into the exclusions list. There's like an annual checklist that we give, and part of that includes having a billing and coding policy manual here. This one's for acupuncture, and we give you all the forms, logs, templates. This is for Medicare. Medicare strongly suggests that you be proactive and put together a billing and coding policy manual. Now, when Medicare strongly suggests something, you should do it. They're not saying you have to do it, but they strongly suggest this is a federal government requirement. Chiropractors are healthcare professionals involved in the healthcare delivery in our country, just like an orthopedic surgeon or a neurologist or a hospital. We are part of the healthcare delivery system, especially because Medicare covers our services. So we are required to have a HIPAA compliance program. Most of you don't have one. I know most of you listening to this do not have one, but it's required. You want to swan, you want to sleep better at night, get a HIPAA compliance program in place. It could be simple. If you have 1 or 2 employees, it's simple. If you have, like some of our clients, we have one client has 80 employees. That gets a little bit more complicated, but you need a HIPAA compliance program. If you can't get one or do it on your own, contact us. We'll help you. So again, I want to thank everybody for attending. We're going to go and take a look at what questions have come in. So again, hope you learned a lot, and let's take a look and see. Thank you, everyone.